We have anatomical position. Anatomical position is always a reference point to look at. So pretty much when you're identifying pretty much everything in anatomy and physiology, you're gonna look at it in the point of anatomical position. So even if you're not in anatomical position and you're in like the hold up position, which one of our professors used as a reference, you still have to look at it as in an anatomical position. Also, to look at when you're looking at someone, you're always identifying the person as they're in an anatomical position from their view. So their heart was on the left side of their body. So that's something just to keep in mind as well. We're also going to look at the regional terms. So I'm going to discuss those now. We have cephalic, which is meaning around the head area. Frontal will be around your forehead area. Orbital, where the eye area is. Nasal, pretty self-explanatory, your nose. Oral is going to be mouth. Mental is going to be around your jaw or chin area. Cervical will be around where your neck is, or where your, just basically where your neck is. Thoracic is going to be around your pec area. Sternal be where your sternum is in that area. Axillary will be around where your pecs are, and memory is where right around here. See memory. Memory is right located in probably the mid center of your pecs. Kind of blurry. But then we're gonna be looking at the abdominal region, which is your abs. Everyone knows the abdominal region. Your umbilical area, which is basically where your belly button is. Your pelvic region, right where your pelvis is right below your belly button. Inguinal or inguinal is going to be your groin. And then the pubic or genital area. Then looking at your upper limb around your arm. Your acromial, which is around where the shoulder area is. Brachial, where your biceps are. Antecubital, which is where your elbow is. Antecubial or antebrachial is your forearm. Carpal is going to be your wrist. Then we're going to look at your manus area, which is your hand. Metacarpal is going to be around the palm area. Palmar, up above where your palm is right before your fingers show up. Then we have our pollex, which is going to be an area of your thumb. And digital, which is where your thumb fingers are going to be. Then we're going to look at the thigh area. The coxal is going to be your hip. Femur is going to be your thigh. Patellar is going to be your knee. Your popliteal is going to be the back of the knee, or on the posterior view. Crural is going to be the medial part of your leg. It's hard to describe. Crural, the medial part where your fibula is, or your fibula. Your fibular or peroneal being the back or this lateral side. Fibular is going to be the lateral side. Tarsal is going to be the medial part of your ankle. Calcaneal is going to be the back of your foot. Metatarsal is where the tarsals are on your foot. Digital is where your digits are, your distal digit, so around where the toes are. Hallux is going to be like the end of the toes that's one side, and plantar is going to be the bottom of your foot. Then we're going to look at more so the posterior part. Cephalic, which is going to be the head. Otic is the ear. Occipital is the back of the head. Cervical is going to be where your cervical C7 cervical spines are. Back, you're going to have your back, which is called dorsal or posterior. Your scapular area, which is where your scap is, or your shoulder blade. Vertebral is where where your thoracic midline of your back is. Lumbar is going to be where the lumbar vertebrae is, around the lumbar area of the back, bottom part of the back. Sacral is going to be right below where your lumbar spine is. And your gluteal, which is going to be your butt. And your peroneal area, which is right between, in the middle, bottom portion. Okay, so there he is with our regional terms, and then the next video we'll be focusing on your anatomical terminology or directional terms, looking at, superior, inferior, all that good stuff. All right. Peace.